My next guest is David Sarabia, CEO and founder of inRecovery. David, come on in. Looking forward to learning more about where you're at now with inRecovery. So break it down for me. What is inRecovery?
Hey Logan, how are you?
Doing great.
Good to see you again.
Yeah.
So inRecovery is an addiction recovery platform that came out of my own personal addiction issues.
Okay.
I went to treatment and I saw a big need for something like this.
Okay.
And what we're aiming to do is help people beat addiction and reintegrate as thriving members of society.
Okay. So you experienced it. You walked through addiction, walked through recovery. At what point in the recovery process did you realize there was something broken? What did you see?
So I've been a tech nerd my whole life. I've been coding since I was 8. I had 2 exits by 27, made a bunch of money, moved to New York, and became a massive cocaine addict, unfortunately. And essentially what happened is that one of my best friends passed away in 2016, and that was the trigger for me to get help. I humbled up at that point. I said, listen, I really need to get help. I'm going the same trajectory. And when I was in treatment, I saw that our clinicians really cared about us. They were very invested in us, but they had no technology whatsoever to help us. So I saw an opportunity to actually build something for the first time, use my skill set not to get rich, but to actually do something good. And that was how inRecovery was born. And what we're doing is we're helping treatment centers become more data-driven, to truly understand the patient and use that data to personalize. And with the use of machine learning and so forth, we're able to then create very personal care pathways for patients.
Interesting.
And then we carry them through the remainder of the continuum of care with our aftercare platform and so forth. Yeah.
How do you feel like your super personal experience gives you a unique advantage in this market? Because, I mean, certainly not many founders had your story.
Right. I mean, it's a tough business to be in healthcare technology.
Yeah.
It's very long sales cycles. It's extremely taxing.
Yeah.
It's very expensive as well because of the sales cycles. So
yeah.
I think my commitment is what really has been affected by this. I can't imagine doing anything else. I could be doing anything I want at this point, but I really am so invested in this, and I'm here till the very end. So, we're trying to make some major changes, fundamental changes in the industry. Their treatment itself is extremely expensive. It's about $30,000 a month to go to treatment. It's a privilege, not a right.
Right.
So we want to be able to use data to then bring this cost down.
How does that work? How does the data bring the cost down?
It's interesting. So we are, in essence, creating the largest data repository that's ever existed on addiction in general.
Okay.
And we want to then understand what actually works for people and be able to then in the future enable remote treatment solutions with our data, with our actual data. So we'll be able to then make something. Let's say a soccer mom that's addicted to pain pills. She had an accident. She was overprescribed. The typical opioid story. This person might be low risk. And she doesn't need to go to an actual treatment facility. She can perhaps go to a remote treatment process that costs $1,000 a month, $500 a month, something that's actually realistic. And she can then check in at CVS, at Walgreens, at the retail pharmacy level. That's our long-term vision, and that's what we're aiming to do.
Why was the data so siloed? Why was that such a problem? You said there hasn't been a system yet that really pulled together the data for addiction.
Right.
It feels like it's so fragmented.
I think it's fragmented because fundamentally addiction is a very difficult thing to track, and also the addiction treatment industry is very new. It really started spurging out about 10 years ago based on the Parity Act, where it became reimbursable and suddenly became a cash cow business. So unfortunately that also led to a lot of malpractice, very poorly set up treatment centers. There's great ones out there, but there's also a big need for innovation, and that's what we're doing.
Interesting. Yeah, I mean, I love to see that you're sort of tackling the problem on both ends. For the recovery itself, but then the system and the recovery centers desperately need that backbone and that data as well.
Right. Yeah, and I mean, parents are at the mercy of these treatment centers. They send their kid out there, and it's very tough, and you have a loved one, you're hoping that they go and get better, and you have no insight into what's going on, and we're hoping to be able to provide that and just peace of mind to people and give people hope.
Awesome.
Yeah.
David, I love the work that you're doing. So glad you could come in, stop into the StartUp studio. Wish you all the best in 2020.
Thank you so much.
And have an awesome afternoon.
Yeah, you too, man. Thank you.
All right.
See you.
Thank you, David.